This is episode 4 of the Trauma Unpacked series, an occupational therapist's perspective on trauma.
The content of this podcast is for informational and educational purposes only. It is not a substitute for professional therapy or mental health services. If you are experiencing emotional distress or need support, please consult a licensed mental health professional.
Welcome to Conversations on the Couch, where we are having safe and sound conversations and dialogue about mental health related issues. My name is Deborah Olusola, clinical psychologist at the Couch, and today we have the amazing, gorgeous, beautiful Emily Makhlouf. Emily is an occupational therapist. Welcome.
Thank you very much. Thank you for having me, and thank you for the beautiful introduction.
You are most welcome, Emily. Thank you for being here. How are you doing today?
I'm well, thank you. How are you, Deborah?
Yeah, can't complain. Hey, I'm really excited about this topic that we managed to get you in. And I think there's just so much for us to learn about your profession and how you help individuals with, because, as you know, this is our trauma series. And I think it's nice for us to understand how different professionals get involved with these type of situations, right? So thank you once again. So I guess I will go into it. What is occupational therapy?
Yeah, so that's a very popular question.
Yeah.
And again, thank you for the opportunity. I think, like you said, it's very important, not only in the series that you're running, but I think people don't know what we do as occupational therapists. And I think it's very important for us to not only share that, but also advocate for our profession in terms of the work that we do, because it's not very widely understood. People know that we exist, but don't really understand what we do and how we do it. So thank you again for that opportunity, and especially on this platform, where we are safe and sound. I think so. As occupational therapists, the biggest thing is that the word occupation is very deceiving, because everyone attributes occupation to our work, our remunerative work. And in the OT field, the word occupation refers to activities. So what we do as OTs is we look at a person's functionality. So therefore we look at their daily activities, because in order for us to function on a daily basis, we need to do different activities. From brushing our teeth in the morning, to driving our car, to accessing public transport, to writing an email, to cooking a meal, to budgeting, to having a conversation, to going for dinner. Every single thing that we do in our day is an occupation or an activity. So in order to understand how people function, we need to understand how they do their daily activities. And what we also need to remember is that people do their daily activities within an environment. That environment can be their physical environment, so like literally the chair they're sitting on, the tree, that sort of thing. Their social environment, so who they're surrounded by, as well as their virtual environment, which is becoming more and more prominent in this day and age. So our phones, our laptops, our social media, all of those are considered our virtual environment. So we engage in these occupations within an environment. And in order to execute our activities within an environment, we need our bodily functions. So whether it's our muscle strength to lift up our arm, or whether it's, the executive functioning from our frontal lobe to make decisions and judgments, every part of our body is responsible for something different in order to do the activity. So if I'm having a cup of tea, I need to be able to pick up the tea. I need to be able to have the judgment to see what is hot, what is cold, is it hot enough to drink, etc. So there's a lot of components of how we engage in an activity. And as OTs, we understand that different things then affect how we do it. So if we break our arm, then it's going to affect how we pick up the cup.
Yes.
If we have a head injury or a mental illness, it's going to affect our executive functioning and therefore how we engage in a task. So we really try and understand, who is this person? That's another very important part of OT, is understanding the person, because at the end of the day, every person presents differently, even if they're the same age, from the same background, with the same illness, whatever the case is, every single person presents differently. And we need to understand who this person is and individualize our treatment holistically and for that person. So individualize it and look at them holistically in order to individualize it. And then, maybe lastly, because you asked for a brief introduction, but
no, we are loving this. Trust me, I'm learning a lot.
I'm glad. So in terms of, another beautiful thing about what we do is the fact that because we look at a person holistically and we understand the human being and how they engage, we can intervene in all areas of life. So from literally birth to death.
Yeah.
And across the board, any condition, whether it's a neurological condition, whether it's a spinal cord injury, whether it's a broken bone, whether it's a mental illness, anything, because we look at function, anything affects our functioning. Therefore, an OT can help. So when we qualify as generalists to be able to treat everyone and any condition. So that's at the end of our training. We can sort of go into the fields that we obviously have a more special interest in, but then we are considered an OT with a special interest in a certain area. So, obviously for me, it's a special interest in mental health, and I study further, from a mental health perspective. But that doesn't then stop us from treating other people. So even though I have my special interest in mental health, I still can go treat someone with a stroke because I still have the knowledge and understanding of how to do that. But another important part is, you obviously know better than anyone when it comes to psychology that no matter what illness or injury we have, our psychology has been affected in one way, shape, or form, whether it's minimal or a lot. It has been affected. So in terms of our role as OTs, that's another reason why we need to look at the person holistically, because if we're treating you for your stroke, we can't forget the psychological component, because maybe you have a low mood as a result of your stroke, for example. So when we are treating you, we need to address both components, not just one.
Which makes sense.
And again, it goes to the holisticness of our treatment. And then the important thing as well is that our treatment modality is activities. So where a doctor will prescribe medication, we will prescribe an activity. So we assess using activities and we treat using activities. So that's why our assessments aren't necessarily worksheet based, for example. They might be sometimes, but we look at how do you engage in your activities. And then I use activities to treat. So in terms of what you can expect when you come to OT, it's less of a discussion and a lot more doing. We might have a discussion to check in and sort of see where you're at, but then 90% of our session is doing an activity. Because if we want to treat your activities, then that's how we do it.
Emily, thank you for that deep description. I think it really helps us and sets the tone in terms of, the rest of this conversation, just to really help us understand, the world of occupational therapy and what it is that you actually do. And I'm happy to hear that you mentioned that, you have a special interest in mental health, and that's why you're here at the couch as well. You play a vital role in the space. But, as I was listening to you in terms of you speaking about just, people's day-to-day activities, brushing their teeth, I think in a layman's term, these are, your mundane activities, and we don't realize sometimes how one can shift from being able to do that normally, and not being able to do that at all. So in a space like this, specifically mental health related, and from your professional experiences, what changes do you notice in some of your clients when they've gone through, and not specifically, I guess we'll get to the trauma part later, but just generally broadly, what are the different factors that can affect people's day-to-day routines, activities?
Look, so I mean, obviously, again, in this space, their mental health. So whether it's like a diagnosed condition, or just things that they may not necessarily have a condition per se, but they're struggling to manage their stress, or even the normal anxiety that we all feel on a day-to-day basis. Sometimes people don't know what to do with that, or that maybe they think that it's a lot more than usual when actually it's congruent to their context, and it's nothing necessarily abnormal. So it's just sort of working through their experience of what they're having difficulty with. But from a symptomological point of view, in terms of not necessarily the symptom of a condition, but what we see from an activity engagement. I think something that I commonly see, because, my main experience is with adults, even though I do work with some kids and some adolescents. But I think in this day and age, the hustle and bustle, and the fast pace of everything really gets, I think, the better of all of us. And what I've been really focusing on with a lot of, the people I work with, is just allowing ourselves to enjoy things again, because we're so caught up in must do this, adult responsibility, must do that, must do this, and I've really experienced that people struggle to experience the enjoyment, and I think we really lose sight of what we enjoy with how things are happening, and that then leads to other stress. And the important thing that I tell my patients and clients is that we need to start at ground level. I mean, if you're experiencing stress, and this is what we're seeing, there's underlying causes. So if I come in and say, okay, right, you're going to do A, B, C to manage your stress, that's not going to help anything when I know there's underlying causes. So I need to treat and address those underlying causes. And most of the time it's that we don't know how to experience that sense of enjoyment, or what we as OTs call a sense of satisfaction, task satisfaction, because we know from an OT perspective, theoretically, people won't re-engage in an activity if they don't experience A, enjoyment, or B, satisfaction. Generally, we'd like to experience both, and that's where we have the most chance of re-engagement. But if we can achieve one of the two, then we will re-engage. And something simple as, oh my word, I made my bed today. I feel satisfied that I made my bed. And I'm really glad that you brought up the tasks that seem mundane, but in reality, they're actually not. There's a lot of motivation to get out of bed and brush your teeth and wash your face and shower. There's actually a lot of motivation to do those things. And I think we don't realize it, and we take it for granted until it's actually been affected. And, by something or other, and I think just also encouraging our patients that we can celebrate the fact that we brushed our teeth. It seems mundane and silly, but if that's going to give us the satisfaction to start our day, then that's what we need. Those things are important. So I think really if there's one thing I've seen very commonly is not feeling that sense of enjoyment and task satisfaction that we call it as OTs, and then we seek it in other spaces, whether it's substances or other behaviors, and then it leads to other pathology. So we don't know how to get it from our simple activities or what seems simple, and then we seek it out in other aspects, and we're looking for things to give us that enjoyment and satisfaction, when actually our daily tasks can give it to us. We just need to relearn how to get it back from them. So
I'm a bit stuck on the task satisfaction, right? Because you're bringing up our day-to-day activities that I think a number of us loathe.
Yes,
for
100%.
example, and I think I'm going to use myself as an example. I hate washing dishes.
Yeah.
And I'm hearing you say we can get satisfaction from some of these tasks, and I'm like, how? From washing dishes?
Yeah.
And maybe you can give us a bit of insight. How do we get into that process or mode of enjoying some of these day-to-day activities? And I guess because it helps us get through them and helps us maintain a clean, and healthy environment and ensure that there's structure where we are living. So how do I get satisfaction?
Yes. Very good question, Deborah. And I think, it's sometimes so difficult to give, an answer to these things because it's so person specific. But something that in my experience I've found works really well is also as OTs, we either treat or use an activity as a means or as an end. So let's say if you have difficulty washing dishes, okay, then we might wash dishes together for me to help you relearn and re-engage in washing dishes, okay? Or there may be principles and aspects of dishwashing that are also within other activities. So I might use other activities that have the same principles to then do that, to then treat dishwashing, if that makes sense. Okay. So I've found it most effective to do the activities as a means because we've forgotten what it feels like to experience that satisfaction. We need to relearn the feeling first. So I work on engaging people in things or in ways, very obvious ways that I know they will get that satisfaction so that they can learn, okay, well, this is what it feels like. And then maybe we'll go to washing dishes and say, okay, well, Why does it, now you know what the satisfaction feels like. Why are we not experiencing it? And then we maybe analyze that activity and how we engage in that activity to see, okay, well, we know this is what it feels like. We know this is what it feels like to not have that satisfaction. How do we get to that satisfaction now? And I think it also goes back to, again, each individual, because for me personally, I don't love the process of washing dishes, okay? But I really love having clean dishes, and then at the end being able to, like, packing the dishes away, for example, is what I enjoy, because now they're clean, and now I have something to show for my clean dishes. So for example, with you, I'd look at, so what part of the process do you least identify with, and what part of the process actually gives you the satisfaction, and then we work on that. But before we can get there, I need you to feel the satisfaction. And I do it in, what I always tell my my patients is in weird and wonderful ways, that ways that you would never have imagined, but that's also the point. And also to expose you into activities that, if we needing satisfaction, we know which ones to seek, if others aren't, and obviously healthy activities. So really analyzing, why don't you love washing dishes, or why don't you get the satisfaction? But again, like I said, before we do any of that, we need to experience the satisfaction. And know what that feels like. Because also maybe before it felt a certain way, and you're holding on to what that felt like. And now we've developed and grown in a different way, in a different environment, and actually it looks different for us. Patients will often come and say to me, I used to love this activity and I don't anymore. And I look at them and say, well, what's been happening? Why don't you love it anymore? What's happened in your life that now is affecting your ability to enjoy this activity or to receive that satisfaction? Maybe you loved washing dishes before and now you don't. Or maybe you were satisfied rather by the clean dishes, and now longer you couldn't really actually care less whether your dishes are clean or not, or whether they pile up in the sink. And again, then maybe we're actually looking at an underlying problem. Maybe there's something else that's causing you to not want or not to feel that. And that's again why I was saying we go to the root cause, because maybe it's actually there's something else happening within you that you don't realize that's actually affecting your ability to be satisfied by washing the dishes. So it's not a very direct answer.
No. You really answered. And as you were speaking, it actually reminded me of a TikTok video I watched this morning, right? Where a young boy had done something at school and he was sent home. And as part of his punishment, mom now made him do all the chores in the house, like from morning right until late afternoon. So, but I went to the comment section because I find it very interesting to read people's responses. So one lady commented that she didn't really like that idea. She said she went through something similar, and as a result, she could no longer wash dishes because she had made that association. So when I think about it, I'm thinking that this is some kind of traumatic response, to now not wanting to wash dishes. And I think it can now lead us into that topic of trauma. So when people experience different traumatic experiences, it can affect
100%
different day-to-day activities, right? And I guess as an occupational therapist, what are the most common, if it's a fair question to ask, activities that change as a result of trauma?
Look, if we had to narrow it down, I don't think we could, select a specific group. But our activities of daily living, so our personal hygiene and our grooming, our dressing, those are often affected. Because we, again, once we've gone through a traumatic event, depending on the nature of it, but sometimes we then sort of revert to that primitive, component where we do the bare minimum. And that bare minimum, and also when we talk about, going back to sort of the primitive stages, if we think of, what's primitive, it's when you're a baby, and when all you do is kind of eat, throw your hands around, scream when you're hungry, and mom feeds you, kind of thing. So our activities of daily living and being able to do what we think are those basic functions can be affected. And so that's definitely a component, what we call a category of occupations, because activities of daily living are different activities, but then we have a group of them, which is the category then. So those can definitely be affected. Our social engagement and what we call social participation in OT can definitely be affected, because if there's been a trauma maybe with another person or inflicted by another person, be it physical, sexual, whatever the case is, it then affects our relationships and our ability to engage with people and maybe to trust people, maybe to set boundaries with people. And so because our social interactions are also activities. So definitely the social component is also affected. Our work, because sometimes in trauma, we know that different parts of the brain are involved, and often our executive functioning can be involved, in terms of, again, from a sort of in layman's terms, like, when our body shuts down. And again, it goes back to sort of that primitive, what did we use when we were, in the primitive stages. And we need our executive functioning for different aspects of our work. And when I say work, I am referring to our remunerative work. But we can also, the importance of work from an occupational therapy point of view is the meaning, satisfaction, purpose that it gives us. And we don't only necessarily get that from work. We can still be productive in our day and feel a sense of purpose, meaning, and satisfaction. So work is obviously the most common one because most people work, that sort of thing. But in our area as well, if people are struggling to obtain work, we can help them in terms of, from a skills perspective, how to go about obtaining work. We can't obviously get them jobs, but, from a skills perspective. But then we also first, in the meantime, get them to engage in something productive, to give them that meaning and purpose in the meantime, while we equip them with skills to job seek and that sort of thing. So our work definitely, and because our motivation can be affected, then really any area can be affected. So we do see it throughout all aspects of our occupations and our daily functioning. But I think if I had to think maybe off the top of my head in terms of specific groups of activities, I'd say those are probably the ones as well. And then if we're looking at also task satisfaction and a sense of enjoyment, our hobbies and our leisure activities are often also affected, because again, we in that trauma state or recovering from that trauma state, that again, we forget or don't realize what brings us joy anymore, or what makes us feel satisfied with how we engage, and that sort of thing. So all areas can be affected, definitely.
Yeah.
And
I mean, obviously the nature of your work is quite practical, and I think it's important that it is. So people come to see you, in your office, to get the skills that they need. And but do you only work in your office space, or do you sometimes have to do home visits to assist them with their functioning?
Definitely, because as I mentioned in the beginning, that part of when we look at a person, we look at them in the environment. And it's one thing for you to say to me, Emily, I live here, it's a 2-bedroom apartment on the main road, what. And you can give me the subjective report about your physical environment or your social environment. But there's a lot of value in me coming and looking at it objectively, as opposed to just your subjective report. So definitely home visits, work site visits, if we're looking at reintegrating you back into the workplace environment, or maybe we want to assess if the workplace environment is actually affecting your ability to engage in your work, then we come and assess the environment. Maybe I can give a very concrete example, in that is maybe, someone's been in a car accident, they're now in a wheelchair, we need to go and assess, is their environment accessible? Is there a ramp? Is there a lift? If they were doing a job that required a lot of walking, how can we make those adjustments? Can they be given more, desk work, for example? Or they can maybe still do the walking around in their wheelchair, as long as it's short distances, or maybe as the endurance improves in their wheelchair use, then it can be longer distances, or whatever the case is. And then also obviously maybe social environment, to sort of assess how they engage in their social environment. So maybe if there's not enough support at home, and we come in just to sort of observe an interaction to sort of see how it's affecting the person. And again, when we look at how it's affecting the person, mainly from an occupational point of view, and an activities point of view. So, the example that you used from TikTok with the little boy and, cleaning the house, and that is also his social environment in terms of how his mom is choosing to parent.
Yeah.
And, that's something that we could also assist with, because everyone responds to different things. So maybe one child might respond positively to that in the sense that they can attribute now their negative behavior with, a consequence, but others maybe not, and others maybe then may lead them to not enjoy dishwashing, for example, because the chores were used as a punishment as opposed to anything else. So those definitely, we look at the different contexts and environments, and how they affect your engagement. So no, my work is not limited to my office. And it's not limited also to, when I do therapy in my office, I make use of the outside space too. The fresh air does a lot, and so does the sun. And again, another thing is we get so caught up in our daily lives that we don't often spend time outside. And there's a lot of value in that. So there's a lot more space than my four walls, but there's also the fresh air and the sunlight.
Gosh, this is so interesting, Emily, and I'm really enjoying it. I still have another example, and I'm hoping that you can really, help us with that, because I'm truly, as I've gotten to know you and understand your profession, I've really gotten to appreciate it more, and that's why I can refer clients to you. So I'm bringing this topic up because I think it's sort of close to home, and I think a lot of people, I know other clients have also dealt with something similar, so it's a bit difficult. But sometimes, a bit downcast is, for example, a loved one passing away at home, right? And I think I'm going to use a specific example of a loved one passing away in the bathroom. So I've seen, a number of individuals who struggle. Now they're still staying in the same house, but they can't enter that bathroom, and they can't bath anymore because of what has happened in that particular space, So people can go to therapy and stuff like that, but you often find that sometimes that doesn't change. The routine doesn't change. The ability to go back and shower doesn't change. So as an occupational therapist who, may have to go to the home and make a home visit, or in an example like that, how would you assist them to, I guess, return back to those old routines, if that makes sense?
100%. So, I mean, the first important thing, and maybe something that I should have really highlighted in the beginning, is the importance of obviously working in a multidisciplinary team. So in a case like that, the work of, the psychologist paired with the OT is so super important, because as the person goes through their psychotherapy process, the OT process, doing them together and being in communication, how we're going about that is very important. So that's just sort of a disclaimer in that regard, because we're all trying to address the same thing in different, throughout different modalities. But again, we would look at, so the problem is the patient is having difficulty bathing, and the cause is because they experienced a loved one passing away, in that bathroom. So as OTs, naturally, and first and foremost, we always aim to improve first, before we look at maintaining or compensating. But I think in this case, what's very important is we can't re-traumatize the person. So we can't now say, right, we're going to get into the bath and we're going to practice how to bath, kind of thing. So I think the important thing is, first we need to just get them to engage in bathing again. So we'd look at how we'd maybe go about that. Maybe there's another bathroom in the house, or maybe they still associate any bath or any shower with that room. So then we'd maybe look at something like bucket bathing initially, and looking at how can we still engage in this activity in maybe an adapted way. And obviously not the focus not being adaptation, because like I said, we always aim to improve first. And obviously we want the person to be able to do re-engage appropriately. But we'd look at first engaging them in bathing, full stop. Because also we know now, if a person hasn't properly bathed for a long period of time, we have other complications, maybe infections or, other things. So our primary focus will be to get this person to re-engage. And as part of my, my master's training, when I studied further, we looked at sort of the sensory component in mental health as well. And I think that's where I'd focus as well, because we know in trauma that's also very grounding. So when re-engaging them in bathing, I'd focus on the sensory component. So the water, the warmth, the feeling of a sponge or a lappy, whatever it is you're going to use, and bring them present to the here and now. What does this feel like? It feels refreshing to bath again, or it feels uncomfortable. Okay, well, why does it feel uncomfortable? Is it because now we're using the same lappy that you used before? Or do we need to look at maybe something else? Are we just going to use our hands for now? Does the scent remind you, that bath feels okay? Let's look at different soap. So really looking at the sensory profile and how this person engages with their senses within this activity. So also just maybe another disclaimer from an OT perspective. There's sensory integration, which is also, another course that we do, but then there's also sensory stimulation. So as an OT with my qualifications, I'm qualified to look at the sensory stimulation part, but not necessarily the integration part, the sensory integration. So that's just a side note disclaimer, but I'd really focus on the sensory component first and really getting that person to re-engage. And similarly to the task satisfaction, remind them what it feels like to bath again. Remind them that actually it feels nice to bath. Because, I'll give you a common example, like with myself, for example. In the morning, I'm showering to shower to get clean for the day. In the evening, I like a nice long shower. I can relax. And the purpose of that shower is not really to clean, but to relax, So just, again, getting back into that we can engage in it and feel nice after it. It doesn't always need to be a necessity to clean. It does, but we can also use it as something calming, relaxing in terms of the sense, the water, the temperature, and that sort of thing. So really looking at getting them to re-engage first before anything else.
Okay.
But it would also be definitely very person dependent. But I think just with the sort of the scenario you've given me, that's how I would sort of approach it in the beginning. But with someone else, it might be different. Maybe someone else can go bath in another bath, and then we'd look at that. And in terms of the representation of that bathroom specifically, and working on what does that mean for that person in relation to their occupational engagement. Not in terms of from a psychotherapy point of view, because that's not what I do. But how does this now affect that? And we use different frames of references, and if the person is at the level where we can use a cognitive behavioral frame of reference, then we can try and sort of match their thoughts, their feelings to their behaviors. But if they're not at that level, when we can do that, we look at purely a behavioral approach, and we match it. Okay, when you do this, it feels like that. When you do this, it feels like that. And not really trying to make the connection, but be very concrete in, I do this, this happens. I do that, that happens. And later make the deeper connection to thoughts and feelings. But in the moment, making the connection with, if I do this, this happens. It's the same with a kid that, what we do know is that when we reprimand children, we need to do it straight after the event so that they can associate their bad behavior, with what they did, and a consequence. And the same with positive, reinforcement as well. That when they do something good, we say, well done, that was good. But we need to be concrete about it. So similarly in this aspect, from a behavioral point of view, we say, okay, well, you see, when you bath, this happens. You are clean, or, you feel fresh, or whatever the case is. And being very concrete about this happens, then that, this happens, then that. And then later go into the deeper things from a cognitive behavioral point of view.
The work that you do, Emily, is amazing. And I really appreciate that explanation that you gave us. I think, and I hope our viewers and our listeners really got a lot from it. But just to round up a bit, I would love to go further into this topic, but, we'll definitely have you on again. Maybe can you, share a word of advice, with regards to the work that you do in trauma, maybe, like what advice would you give our listeners and viewers?
I think it's maybe similar to some of the advice that, I know my colleagues as psychologists give as well, is that, it's difficult to get help. And I think something that people underestimate is that, maybe just because we're not psychologists and we don't, maybe go a bit deeper sometimes in, from a psychological point of view, we actually do when we do activities. So our space can be just as vulnerable as any space, seeking any form of help. And I think people underestimate that in the beginning. But in order for me to understand you, I need to go deep. You know, so and in order for me to help you, I need that understanding. So I think people don't often understand how vulnerable our process is, and maybe just to encourage people to stick through it. That when you work past that vulnerability, that's where all the change happens. And the unfortunate, or not the unfortunate thing, but I think as humans in general, we like the instant gratification, and so it's hard to work through that vulnerability. And often at time I've seen, you know, the most challenges with my patients is when they're in that vulnerable space and they're trying to pull back, but they need to be there in order for us to get to the progress, because we can't get to that progress if we're not vulnerable in the beginning. And again, that vulnerability can come in all shapes, you know, all different sizes, shapes, everything, and we need to push through that. So I think the biggest thing is understanding and learning to push through that vulnerability to get to the progress, because the results when we get to that point are great. And that's when my patients turn around and say to me, shucks, actually, you know, you were right. You know, like there really is, you know, this method to your madness, and, you know, all the weird and wonderful ways that you do things, they're actually working, and I really never thought they would. But I think, so just maybe some words of encouragement is push through the process.
No, it's absolutely profound what you've just said.
Know, so,
That you need to, I mean, obviously to understand them, you know, you have to go deeper. And you also mentioned that something a bit earlier in terms of forming deeper connections with these day-to-day activities, you know, so that you can continue to engage and then
100%.
find some kind of connections. So thank you for sharing that
Thank
with us.
you,
and
Deborah.
I really hope that it would educate people to really understand your profession and get more value out of it.
100%.
Because we definitely do.
I'm so glad to hear that.
Thank you so
very
much.
Thank you, Deborah. And thank you for having me in for this opportunity.
You're most
I
welcome.
really enjoyed it.